Hi, I'm Dr. Danielle Pollock. Today we're talking with Dr. Tim Barker about meta-analysis. Thanks for joining us today, Tim.
My pleasure.
So can you tell us what is a meta-analysis?
Sure. A meta-analysis is simply a statistical technique when we combine data that is comparable and similar enough from multiple different primary studies, let's just say RCTs. We combine them to create a synthesized pooled effect that combines all this data together.
So why should we perform a meta-analysis?
Well, meta-analyses are typically performed in systematic reviews of effectiveness when we're trying to determine whether an intervention compared to a comparator achieves the intended effect on a health outcome. So they really help us to answer questions of effectiveness, particularly the effectiveness of an intervention, a health intervention.
When is a meta-analysis appropriate? You talked about for effectiveness, but is there any other reason why we would be doing a meta-analysis?
Well, yeah, there are many different reasons why we would do a meta-analysis. To answer the first question about the appropriateness of doing a meta-analysis, it's a really good question because just because we have multiple different studies, say, included in a systematic review of effectiveness, doesn't mean we can just lump them all together in a meta-analysis. These studies need to be similar enough, or what we would say homogeneous. They need to be homogeneous in the terms of the participants that were included in these studies. They need to be homogeneous in terms of the interventions used and the outcomes measured. We do not want to see heterogeneity that exists between these studies. Now, we would also do a meta-analysis, say, if we're not interested in the effectiveness of an intervention, but we're trying to determine the, let's say, the proportion of a disease within a single population. So if I want to know the number of people within a certain population that have, say, heart disease, I could do a proportional meta-analysis on multiple different studies that have each got their own individual proportions that I could pool in a proportional meta-analysis.
So what would be your main advice for someone about to do a meta-analysis?
Well, firstly, I would strongly suggest that they are immensely familiar with the studies that they want to combine. And that will come with doing a systematic review. You will become an expert in the literature that you're reading. That's just part of doing a review. Now, I would also suggest that you are familiar with the basic principles of doing a meta-analysis, that being what statistical method you're going to choose, what statistical model you're going to choose, what effect size for your data, whether your data is dichotomous or continuous. Now, all of these questions, most experienced statisticians and meta-analytic researchers will know of. But for those of you that do not know what are the answers to these particular questions, I would strongly suggest that you read about them, attend some educational courses, read the JBI Manual for Evidence Synthesis, read the Cochrane Handbook about meta-analysis. All of these are great resources to help learn and educate yourselves on how to do a meta-analysis.
Thanks, Tim, for your time and talking about meta-analysis with
My
us.
pleasure.